endeavor to fight against COVID-19 spread within our county. I'm going to share good news, bad news like we normally do, but I'll start this week with kind of big picture types of items, which really kind of helps to tell you where we're headed this week in Orange County. First, we will continue to assist the State Department of Health in Orange County in the distribution of vaccine to those 65 and older, as well as healthcare workers with direct patient contact in our community. And we're going to explain that a little bit more in just a few moments. Number two, we will continue to send our compliance or strike teams to businesses to make sure they are complying with the county's facial covering executive order. We're doing that because all of the experts tell us that it is still important that we wear the facial coverings when out in public if we really want to get in front of the spread of the virus. Number three, we will continue to offer free COVID testing at Barnett Park. We repeat that at the beginning of each week. Why do we repeat it? Because people still really do want to know their status. They want to know whether they're positive or negative, especially as they have now seen more family and friends who have become seriously ill or died. Our partnership with the Department of Health in Orange County is at the Orange County Convention Center, which is open 12 hours a day, Monday through Friday. This is where we continue to offer vaccinations and testing. Dr. Pino tells us that over 84,000 residents have received their first dose of vaccine, and nearly 20,000 residents have completed the full two-shot series here within our community. This includes vaccinations given at local hospitals and healthcare centers. While the Department of Health is taking the lead at all adult living facilities and long-term care facilities, Orange County Fire Rescue's paramedics and other paramedics here within the county, inclusive of some municipalities, are assisting with senior living facilities. Paramedics have plans to visit over a half dozen senior living communities this week to give first shots, in some cases, second doses of the vaccine. So far, paramedics have reached over 3,200 seniors by taking the vaccine directly into senior communities. For more information on the vaccine, please go to ocfl.net/vaccine. And now let's talk a little bit about the numbers. Today, there is a reported 99,143, that's not correct. We have 103,649 COVID-19 cases in Orange County. Last week, when we started the week on Monday last week, we had 99,143 cases. So this week, we began this week at this first press conference with 103,649. That indicates about 4,506 new cases in the last week alone. That's bad news. That is an increase of, since Friday, when we had our last press conference, 318 new cases. That includes Saturday and Sunday. The latest figures also show 958 Orange County residents have died from the disease. Dr. Pino can tell you more specific details about those who died. Last week, when we had our first press conference during the week, we started the week off, we had 895 deaths. So in the last week, 63 deaths have occurred in Orange County. If there's any promising news, the 14-day rolling positivity rate is going down. If the trend continues, we should see numbers below 10% sometime next week. That's good news that the trend is going down. Some bad news. Bars and nightclubs are falling behind. Our business compliance or strike teams were out this past Friday checking on 4 local bars and nightclubs to make sure they were in compliance with the facial covering order. Of the 4 establishments, the teams visited, none were in compliance. Patrons were not wearing masks, and there was no social distancing. So guess what? We're going to be visiting bars and nightclubs this week. All 4 businesses will be issued citations who were found to be non-compliant. If you care to know the names, the Knights Library, the Knights Pub, and Infinity Night Club, all in East Orange County, and the Tin Roof which is located on International Drive. Our strike teams report that they have noticed this uptick in crowded venues. So we want them to continue complying with our facial covering order. The consequences are that they face a $300 citation. Since I signed the executive order allowing the teams to warn and fine businesses, the teams have visited over 1,500 locations. They have handed out 103 warnings and 21 citations. Okay. On to other news that I will share with you. From Friday until Sunday, the Orange County COVID testing site at Barnett had over 3,800 individuals who went there for testing. Orange County Health Services operates the site from 9 a.m. to 5 p.m. 7 days a week. Residents, again, can get either the rapid test or the PCR molecular test through the end of this month. Again, you can get information from ocfl.net/testing for more about the testing location. Now I'm going to turn it over to Mayor Buddy Dyer with additional information, and then I'll come back up and talk about some additional.
Thank you, Mayor Demings. Thank you all for being here. To show my confidence to the community and the guidance that our America's leading medical experts, as well as the safety and effectiveness, I received my first dose of COVID-19 vaccine in late December. I think most of you were here for that with Mayor Demings. And I want to share that last week I got my second dose out at the convention center. Had a little soreness in my arm, but no other effect at all. I've heard some people getting their second doses have a little bit of a reaction, but I can tell you that all I had was just a little bit of soreness. I received the vaccine to help my family, my friends, and every person in our community stay healthy and safe. And we know that the vaccine will prevent illness and deaths from the virus. So getting the vaccine gets us on a path towards spending time with each other again the way we used to return to family gatherings and holiday events. At the same time, it helps us move our economy forward by ending the pandemic. So we know that the vaccine distribution will take some time. The state of Florida has prioritized residents 65 and older, and I know Mayor Demings is going to talk about additional healthcare workers as well in just a minute. But I want to encourage every person in our community, when it is their turn, when they have access to the vaccine, to take it, to have it administered. While I was at the convention center, I also had the opportunity to thank the professionals from the health department, from Orange County Fire Department, from Orlando Fire Department, and it was a great operation in terms of the efficiency of administering the vaccine. So Dr. Pino, you and your team are doing a fantastic job, and I want to extend my appreciation for that. As a city, we continue to support Orange County and the Department of Health and the state on vaccinations. The fire department, the police department, and the city's transportation team have provided support for the state-run vaccination sites that they're doing at churches. So St. Mark AME was last week. The team supported yesterday out at Mount Pleasant Missionary Baptist Church. And our Orlando Fire Department paramedics, along with the Department of Health, are also vaccinating seniors in senior facilities. So far, we've done 6 different facilities. Most of them are the high-rises in the downtown area. 620 senior residents have received their first vaccination and will continue for the next several weeks. So I want to thank all of our first responders who are participating in that. A little bit of good news. Our local economy is moving forward. Camping World Stadium is hosting patrons for events in the coming weeks. We had our 3 bowl games during the holiday season, and now monster trucks and motorcycles are coming back. The Monster Energy Supercross, which is part of the FIM World Championship, comes to Orlando February 13th and the 20th. And Monster Jam has 3 events over 2 days on the 27th and 28th of February. Health and safety of the guests will be our primary concern. We will require face covering, enhanced measures to socially distance, and also reduce capacities at the stadium. Tickets will be mobile only, and we've implemented technology upgrades to transition to a cashless and touchless environment. with those measures, we remain committed to providing a safe environment for our citizens to be able to enjoy the shows. With that, I'll turn it back over to Mayor Demings.
Okay, thank you, Mayor Dyer. And the next issue that we're going to talk about is good news. We have received a lot of inquiries about when will we be providing more opportunity for frontline healthcare workers to become vaccinated, regardless of their age. And so we are excited to announce an ongoing initiative with Advent Health that will allow us to quickly and conveniently vaccinate more frontline healthcare workers in our community. The Florida Department of Health in Orange County is allocating more than 3,000 doses for healthcare workers, regardless of the healthcare system that they are affiliated with. The vaccinations will take place this coming Saturday, February the 6th, at a pop-up site that Advent Health has launched outside or near the Orlando International Airport. Any healthcare worker with direct patient contact is eligible regardless of the healthcare system affiliation. It is important to note that appointments are required and walk-ups will not be accommodated. So we ask that you use the sign-up link that is available, and the portal is open right now. You can go to ocfl.net/vaccine. ocfl.net/vaccine for health care workers. Again, this is for healthcare workers regardless of their ages. Advent Health opened this site last month as a pilot location and successfully and seamlessly vaccinated nearly 7,000 people within our community. We're thankful to be community partners with Advent Health on this effort as they have stepped up to the plate to assist with the distribution of vaccines within our county. Joining us from Advent Health in the white coat, Dr. Scott Brady, who is the CEO of Central Care, which is operating the vaccination site. And so with that, I'm going to ask Dr. Brady to say a few words with you, and then we will transition to Dr. Raul Pino, who you all hear from on a regular basis. Dr. Brady.
Thank you so much, Mayor Demings. Mayor Dyer, thank you. It is so exciting to be here. How many months have we, Mayor, been on virtual calls since March of 2020, figuring out how to fight this best in our community? Playing offense as much as we can with social distancing and washing our hands in masks, and defense, preparing our hospitals and our providers to treat this as best as we can. But now, with the vaccine, what an exciting day. We are so excited at Advent Health to partner with Orange County to vaccinate a very important group of people, that is our healthcare providers. As healthcare workers on the front lines are central to treating our folks that get infected with COVID, we want to make sure they're safe so that they can help our community and that they stay safe. This vaccine is for all healthcare workers in our community, not just Advent Health healthcare workers. So if you are any healthcare worker and you have direct patient contact, this day is for you. As the mayor said, there is a link to sign up. We have over 3,000 vaccines that will be sign up only. No walk-ins in this, and our event will be Saturday on Tradeport Drive, where we will, from 10 a.m. to 6 p.m. By appointments, be giving out this vaccine. It was 16 years ago that we partnered with Orange County to begin giving mass flu shots to the community. And over those 16 years, we learned together how to give them to 2, 3, 4, 5, 6,000 people at a time. And that has been a blessing so that we can do what we're about to do. All told, Advent Health has vaccinated more than 37,000 people in Central Florida, and we look forward to vaccinating 10 times that when the vaccine is available. A couple weeks ago, as the mayor said, we opened up this site about 3 weeks ago and vaccinated almost 8,000 folks with their first dose of Moderna vaccine. Those were elderly folks. What a wonderful day. And how thankful folks are to get the vaccine, and how appreciative and how excited we as healthcare workers are to give it to them. That was one of my favorite days in a long time. And I'm so looking forward to this weekend as well. We believe our process works. It worked quickly. People were about 30 minutes from getting out of the car to getting back in the car, and that included 15 minutes waiting after the vaccine. So that was seamless. I want to thank Dr. Pino and Mayor Demings for their trust in the partnership. And I'd like to ask our community to get the vaccine when it becomes available. This vaccine is safe. This vaccine prevents the disease. This vaccine prevents the spread. This vaccine is what we need to go on offense to help stop this pandemic. So thank you, Mayor. I'll turn it to Dr. Pino.
Thank you, Doctor. Thank you, everyone. Good afternoon. So I'm going to quickly go over the pandemic's number because I want to give you more detail on the vaccination. And the mayor have mentioned to you some of the numbers. I want to highlight that our recovery rate has increased to 93%. And that's also a function of the decrease on the number of cases daily, as well as the positive rate that the mayor mentioned is continuing to decline little by little. We also have 958 deaths. That is an addition of about 21 deaths from when we saw you last. The range was from 28 years old to 90, with a median age of 75. 7 were male, 14 were, 7 were female, 14 were male, 1 American Indian, 1 Asian, 7 black, 2 other, and 10 were Caucasian. The ethnicity, 6 Hispanic, 14 non-Hispanic, and 1 unknown. 15 of those individuals had pre-existing conditions that we know of, and 8 out of the 21, that is 38%, have been reported to have an assisted living facility address. With regard to the vaccination numbers, happy to say that we have reached over 100,000 doses given in the county. The exact number as of this morning was 1,540. So 100,005 The total number of dosage given to Orange County residents, 103,000 with 926. Now, the number of non-residents that has been vaccinated in the county, 1,114. And I always make a point that not everyone who vaccinated in the county resides in the county. We have a lot of healthcare providers and others who do not live in the county but work here. Now, at least with one dosage, 84,755, that gives us a 5.6% of our population have received at least one dosage. Just another number, interesting number. The hospitals has given 43% of all vaccinations. The Orange County Health Department with the Orange County government, about 35% of all vaccinations. Pharmacies in our county face about 4.9% of all vaccinations, and others, which is a large category, about 16% of all vaccinations. Another point that I want to make to the public is when you bring your QR code, remember that for the second dosage, you have a QR code. It is important that you bring your second dosage QR code. When you receive the email, you will receive 2, one for the first dosage and one for the second one. It's important that you bring the second one because that one tells us that you had the first dosage. So, and that will tell us which one we have to give you. So that second QR code card is important for your safety and for us to be able to expedite the process. We are starting to communicate with non-residents that has prospective appointments to let them know that if they are not residents of the state of Florida at least part-time, they should cancel the appointment, and that everyone should be ready to provide identification or otherwise documentation that they are residents, at least part-time, of the state of Florida. With this, please wear your mask, wash your hands, while you distance. We are beginning to make inroads and fighting this pandemic, but we still need your help and compliance with CDC guidelines so that we can continue to successfully advance. Thank you.
Okay, with that, we're going to open it up to questions. Just as a reminder, if there's any Spanish-speaking media here, we have the ability to translate. I do acknowledge that Commissioner Gomez-Cordero from Orange County has joined us. Ms. Ilia Torres is here to assist with translation, and Dr. Pino is fluent in Spanish. And with that, we'll open it up to any questions at this time. Of course, we start with Ms. Lauren Seabrook and Dr. Raul Pino.
Actually, I was wondering if I could ask a question of Dr. Brady, if that's okay? Switching it up today, I know.
Just Dr.
Lauren Seabrook, Channel 9. I'm curious, in addition to the extra doses that are going to be going to healthcare workers this weekend, do you all have any extra doses, or what is your process for people with comorbidities that are under 65? That's probably the biggest question we're getting right now. A lot of people around our community really feel like they need to be getting this. It's in the executive order from the state that only the hospitals can give these vaccines to that category of people. So what's your process for that?
So when we get the vaccines from the state, from the county, partner with the county, those vaccines are earmarked for a particular group. When we first got vaccines, it was the 1A group. Those were the healthcare workers. We distributed those to the healthcare workers. We got some other vaccines that were earmarked for seniors. There's where we give the 8,000 to the 7,681 to the seniors about 3 weeks ago. We're expecting another shipment from the state, a small shipment, about 500, where we're giving to very, very high-risk folks, transplant patients, things like that. We're going to do that tomorrow. And then our partnership here is going to go to the healthcare workers for this 3,000. So as we get those dosages in, we're looking forward to giving more and more out. We're looking forward to giving them to more seniors, looking forward to getting more doses in for those that have comorbidities as well, and finally to the general population.
Dr. Brady, Emily Braun with News 13. Just kind of bouncing off of Lauren's question a little bit further. So talking about people with comorbidities, what are some of the examples of comorbidities that need to be present in order for a person to qualify to get the vaccine in that category?
So again, right now, we don't have vaccine distributed to us for those comorbidities, but when that does come, comorbidities, it would make you higher risk. Folks that have had heart disease, folks that have had lung disease, folks that have diabetes, hypertension, those are predisposing things that make you at a higher risk for getting COVID. And those will be spelled out as well when they come, but those are some of the highest comorbidities.
All right, this is Melissa Thomas of Florida National News. This question is for Mayor Dyer, actually. Just wanted to follow up a little bit more in terms of, you made the announcement, of course, that you did get your second vaccine. You mentioned there was a little bit of, kind of soreness at the site of the injection. Is there any other signs that you would kind of give the residents that are awaiting that second dose? Because I know you are encouraging folks to go ahead and get their vaccine.
I know others that have received the second dose, including Dr. Pino and Mayor Demings, had more of an adverse reaction than I did. Mine was no different than a B12 shot, quite honestly, in terms of the soreness in the arm. But I know that some people do exhibit other symptoms. They're somewhat lethargic, and I might let either of them speak to their experience as well.
So many of the side effects are reported to the state and through the webpage, also through the CDC. What we have seen the most is very mild side effects with regard to, point of injection and some rash in the area. Some people have experienced temperature. I did experience temperature like 24 hours after. And some people have experienced mild, like when you are going to get the flu. But also the side effects are not all that bad, in the sense that it's also an indication that your body is reacting to a foreign element that has been introduced, so your immune system is gearing up to fight. So yes, there are some secondary effects for some people, but they are not that crazy, and they don't last more than 24 hours.
This question is for Dr. Pino, Carla Ray from Channel 9. Some advocates in the disability community have called for better access, easier access for seniors with disabilities, including the idea of fast lanes at sites like the one at the convention center. Is that feasible? And if not, why not?
So it's not a why not. The site is not designed to have an extra lane. But with regard to seniors with disabilities, we have increased our outreach to seniors with disability. And instead of them coming to us, we are going to them. We have vaccinated about 3,000, more than 3,000 seniors in their homes. We are doing that in collaboration with the Orange County Fire Department and other municipality. Orlando is one of those as well. And we are planning to increase those activities. Senior with disabilities, the one that cannot drive, we are at some distance from urban concentration when we are at the convention center. So with that, we prefer to go to senior housing where we find these individuals. But we have a lot of work to do. That's not the end. Because then you will say, how about the isolated seniors that may live alone in a home? And we also are elaborating a plan for that through the county with emergency department. And the normal registry that we have for natural events, hurricanes and other, and the ones that we have for the shelters for special needs that we open. So we have a listing. And as we have the ability, and as soon as we have the ability to go to their houses, we will. It's more about training. We have to train all the paramedics on how to do injections. And it's also about having the right volume of vaccine that will allow us to do that. But understand that process is a very slow process because it's one by one. But yes, we have a lot of work still to do to reach everyone. We just cannot reach everyone at the same time.
Nikki Zizazo with News 6. You mentioned that there will be roughly 3,000 or so doses that will be available to all healthcare workers. So many people who've been trying to get the vaccine, have been frustrated because they say, look, I have every intention on getting it, but as soon as I try and get it within 8 minutes, there are no more, as you mentioned, by appointment only availability. So at this point, with the governor announcing more shipments are going to be sent to Florida, when do you guys anticipate you'll get another shipment for some of the healthcare workers who may not be able to be registered in time to get it on Saturday?
Yeah, that's a great observation, and that's great news that we have more demand than we have supply. I'm so thankful that so many people want it. And when we put up our link, it'll fill up within minutes to an hour. And so when we designed these, and Dr. Pino designed his vaccine events, we designed these to be something that we can do every day, 7 days a week, and expand as we get more and more supply. We haven't heard a definitive date of when we're getting more supply, but as the days go on, it seems like it's starting to open up.
This question is for Mayor Demings. Danielle Lama with Fox 35. Mayor, hearing that out of the 4 businesses that the strike teams visited, none were in compliance. Do you know what they were seeing out there? And is it frustrating hearing some of the same names come up over and over again?
Yeah, some of the bad actors, you've heard their names before. But we have resolved that we're going to continue to be relentless and going to businesses and ensuring that they're following the facial covering executive order. And that means that we do have to circle back from time to time to some of the businesses. And we do receive complaints from various sources from time to time about different businesses. And we're going to be responsive. So as I said, that because the focus this past weekend was on bars and nightclubs, and we found none of them to be compliant, I said to you, well, guess what? We'll be visiting bars and nightclubs this week. So those types of businesses, they can anticipate at any given time that the strike teams can visit their business. and that can subject them to the fine. That's what we have to do. We're going to continue to do it.
This is for Dr. Brady. This is Steve Hudak from the Sentinel. I like the football analogy, offense and defense with the last name Brady, so.
Well, Tampa Bay, you know.
Sure. My question is, you said that you were expecting about 500 doses, that maybe as soon as tomorrow, for people who have comorbidities. Is that only for Advent Health patients, or is it for patients from other hospital systems as
Well, my
well?
understanding is that many hospitals are receiving the same from the state, and the allotment at Advent Health in Central Florida was 500 doses. And so we send out opportunities for the highest of high risk. These are transplant patients, immune suppressed patients, and we're going to do those. But my understanding is we're not the only hospital doing that. The other hospitals are also doing that to their very, very high risk.
And for the last question also, Tim, why don't you come forward? I think part of her question, I may not have answered it, and it was, what do you see in the businesses that were not compliant, to give her a full answer?
Yeah, we've been out to these bars enough cases. I think most of the citations that we have written are based on some of those nightclub activities. Certainly, one of the aspects that has kind of put them in kind of a precarious position is, the governor says we're open for business. Bars like to have a lot of people in there, so it's tough to keep that social distancing. I think what we're seeing is not only that, but the downfall of just not wearing masks. When you get a lot of people in an enclosed space, not wearing masks, it's a recipe for disaster, and we're trying to avoid in keeping people safe in some form and fashion by keeping that out there and making sure that they social distance if they're in there. Everybody wants to have a good time. We want to make sure everybody has a good time, but we have to be safe. I think the message has been clear from day one. Wash your hands, wear your mask, social distance, and we can get through this if we just all adhere to those rules on that.
This next question comes from Austin Fuller in the Orlando Sentinel. He's working on a story about how Seminole County is using a former Sears store at Oviedo Mall for its coronavirus vaccinations. So his question reads, he wanted to check in with Orange County and the Department of Health in Orange County to see if they are considering or would consider using vacant mall space, such as Orlando's Fashion Square or elsewhere, for vaccination sites in the future.
We have our eyes in one place, but also no one else has the Orange County Convention Center. Why we would like to go to an empty mall if we have the Orange Convention Center? So.
Thank you, Dr. Pino. This next one comes from Jerry Askin from WKMG. He just would like a clarification on who gets to decide where vaccine sites pop up. His question reads, is it up to the state or the county to decide where community vaccination sites are placed? This is outside the convention center, he's asking.
So that's a local decision. We consult with the government here, the local government, with the mayor and his staff. Normally, the mayor will indicate some areas, but it's all based on data. When we expand, it's going to be based on data. But regarding with that, also some spaces have limitations. So it all depends what you want to do. But we know right now that we should try to establish some type of site in the Pine Hill areas. We would like to reach more of the Afro-American population in that area. We also know that we have to do a better job at the east part of the county if we want to reach large number of Latinos. So we are watching the data, and it's truly amazing how to see that, the issue that we are having. Remember at the beginning of these, your question was about hesitance and who is going to get the vaccine. Do you think people are going to get it? And now the problem that we are having is the reverse, which is a good problem to have. We have a high demand. The last time that we opened the portal, it fills in 30 minutes, 8,000 slots in just a few minutes. It will fill again when we open again. And the idea is that use data to help us to analyze where we need to be. doesn't mean that necessarily we can land in that specific site, but as close as possible. And we are looking for areas, an ethnic group, that are having a lower representation in the number of people that we have vaccinated.
Thank you. This next one comes from Nadine Yanis from News 6. She wants to ask why Orange County has decided to stick with its current reservation system and not move forward with the statewide pre-registration site. What issues have you encountered, and was Orange County prepared for the switch?
So that's a difficult question in the sense that the county was generous enough to extend the contract that they have with CDI McGuire for another month, for the entire month of February. And that's going to give us the time to observe how the other platform perform. It's not that we haven't decided or not. We may not have a choice at the end, but for now, we are waiting for that platform to be fully implemented and see how it performs. One of the concerns that we have is data entry. And our system that we are operating right now doesn't require any data entry from our end, and we would like to keep it that way because, again, as I mentioned before, giving the vaccination is the easiest of all things in the vaccine world. It's what happened before and after that complicates, and data entry is one of those.
Thank you. These last two questions are from Mayor Demings. Matthew Petty with WMFE. Mayor Demings, are there plans for vaccinating inmates at the Orange County Jail? For example, those inmates who are high risk for infection.
We have reviewed the prevalence of COVID-19 within our inmate population. I'm happy to report that we have very few instances today of individuals who are positive in our jail. And at some point, as the availability of the vaccine increases, so will the locations that we will begin to offer the vaccinations, and that will be inclusive of our jail. Remember, local jails are short-term types of facilities. The overwhelming majority of individuals who are booked into our jail are also released from jail. So maybe 20% or so of the jail population is there on felony charges and stay for longer periods of time. But the overwhelming majority of the individuals are in and out. So it may or may not be the most effective way to disseminate the vaccine, but if we had greater supply, we would. The area that concerns me perhaps the most is in terms of the disparities we see with the lack of fewer people of color being vaccinated. I've looked at the data Dr. Pino has shared with us, and we know we need to do some catching up there. But at this point, the county does not control the inventory of the vaccine. That is controlled at the state level. And in many instances, the state decides who will get the vaccine. In fact, there have been, even recently, some sites where the vaccine was distributed, and the sites were chosen by the state. I believe that as we move forward, what we want to do is to, given the data that Dr. Pino talked about, we want to be able to respond appropriately geographically to ensure equity in who gets the vaccine. And I realize that in some cases we have some challenges with the optics, where some people feel like if you are a certain income, certain race, certain ethnicity, you don't have adequate access to the availability of the vaccine. My goal is to the extent I can, with not having control of the supply, when we are given an indication of the supply, to work with Dr. Pino, work with our private sector provider and others to ensure that there's equity in how that available supply is distributed.
Thank you. And this last question comes from Ryan Lynch in the Orlando Business Journal. From Mayor Demings, his question reads, what kind of businesses are you seeing getting more fines or warnings? Has it been a mix?
We have seen, as of late, obviously nightclubs and bars, we've only issued 21 citations. And so as Mr. Bolduc indicated, these are places where the density is high, where, because of the crowd that's there, these are primarily young adults, and they take risk. They're healthy individuals. They may take risks that others who may be 65 or older, or who are in vulnerable populations, they won't take the risk. So I think that's what we see. In some cases, we've seen some other retail types of outlets, whether they be restaurants or other retail establishments where people are going to patronize those businesses. In some rare cases, there have been automotive repair shops and small businesses like that, but they have focused since the order went into effect December the 4th on a myriad of different types of businesses, and they're going to continue to do that. But obviously, when we see the indication that we have a problem with a specific type, then it requires an immediate response and focus in that area. Okay, I believe that is the last question. So just as a reminder, we will do another briefing on Thursday of this week, February the 4th at 4:30 p.m. Thank you all for attending today.